I'm Hunsaker. I'm a physician assistant student with Philadelphia University. Today I'm going to be portraying a patient with a relatively common complaint depending on where you practice. Today I'm going to be a 55-year-old male. I'm presenting to the emergency room with right-sided facial pain that's been going on for about 5 days. I describe it as a stabbing or electrical pain. And that initial pain lasts for 30 seconds, and it's followed by 2 to 3 minutes of burning, deeper pain. And my symptoms are made worse with movement such as chewing and drinking cold fluids.
Hi, I'm Nick Nelson. I'm also a physician assistant student at Philadelphia University. I'm going to be portraying the physician assistant doing the physical exam components on our mock patient here. Throughout the video, you're going to see text flying onto the screen. It's going to be various pearls and pitfalls. We're going to want you to definitely pay attention to different parts of this physical exam. Just little tips and tricks on what to remember, things to do, things not to do. So for this physical exam, we're going to already assume that I've taken the patient's history, and I'm going to go straight on into the physical exam. Just to briefly do a rundown of what I'm going to do. I'm going to take the patient's vitals. I'm going to do a general survey. I'm going to explain what I would write in my chart of how this patient presents. I'm going to do a skin exam. I'm going to examine the head, the eyes, the mouth, the heart and lungs, and I'm going to do a full neuro exam. So just hang tight, watch how I do it, and hopefully you pick up just how you're supposed to do everything. All right, so for the vitals, I'm going to already assume that I've taken the height and weight. With the height and weight, you're going to be able to calculate a BMI. The BMI can be important for this patient's presentation because if they have an abnormally high BMI where they're overweight or obese, those can be risk factors for hypertension and heart disease, which is a major risk factor for temporal arteritis, which is one of the differentials for this patient. So I'm going to take his height and weight. For his blood pressure, I have my blood pressure cuff right here. And take it, starting in his right arm. You want to make sure that your patient is seated. What's that? Yeah, pull your shirt up. I want to make sure that his shirt is pulled up all the way. Going to get a more accurate reading. You're going to want to take this blood pressure bilaterally. So I'm taking it in his right arm right now. I'm going to have him put his arm right here. And I'm not going to take it in his left arm for this video, but you guys just need to know that for completeness sake, you're going to want to take it in both arms. All right, luckily Kyle's a healthy patient. He's at about 120 over 75. So start with the blood pressure. Also, with the blood pressure, if he was hypertensive, again, that's a risk factor for heart disease, which could lead to temporal arteritis. All right, next for his pulse, you're also gonna do this bilaterally. You wanna take it on the same site on both sides. So I'm gonna do his radial pulse. You're gonna wanna check that for 30 seconds. And I'm not going to obviously check it for the entire 30 seconds, but again, pulse is included in the vital signs. You're going to assess the rate and rhythm, whether it's regular, irregular, if it's a strong pulse, if it's a weak pulse. So respirations, you can do this while you're checking the pulses simultaneously. One of the things that I've noticed is that patients will, hold their breath more or try to breathe like better, I guess, to impress you. So you want to count their respirations while you're counting their pulse so you can get a better accurate measurement of their respirations. Okay, so I measured pulse respirations. I don't have a thermometer on me, but I would take an oral temperature on this patient to assess for fever from possible infection or malignancy that could be contributing to his symptoms. Okay, next, like I said earlier, for general survey, you're going to include that in like the first sentence of charting on your patient. I'm gonna be checking for his appearance, if he's looks healthy or if he looks sick, his level of consciousness, if he's awake alert oriented. Our patient would probably be in considerable amount of pain since that's what he's coming in with. His level of distress, a lot of times when people are in pain, they're going to be more distressed. They're not going to be relaxed. I'm going to be examining for his posture. I'm going to be looking at his expression. Facial expressions can tell you a lot about the amount of pain that a patient's in. And then also motor activity. Okay, so for the skin, I'm going to be inspecting the skin from head to toe. His head, his ears, his neck, his arms, his legs, and again, I would examine all of his skin if the setting was appropriate. I'm looking for lesions, some fluid-filled vesicles, specifically those that aren't crossing the midline, like if he had a herpes zoster outbreak. If he did, that could be a reason for his symptoms, but that's basically what I'm going to be looking for. Obviously, I'm going to be inspecting and palpating for warmth, any tenderness, any redness, any bruising, again, from head to toe, but specifically for our patient's complaint, I'm going to be looking for those vesicles. A lot of times they're found on the mid-trunk. For his complaints, you might see him on the face, especially for how old he is. He might be a candidate for herpes zoster. Okay, so for the head, I'm gonna inspect the face, the sinuses, and the head. I'm just looking with my eyes for the inspection. I'm looking for erythema. I'm assessing for inflammation or any trauma. Palpating. I'm going to be palpating the head and seeing if there's any tenderness or pain associated with giant cell, which would be right here. If you had giant cell, this would be unbearable over the temporal region. And then also for the face, since he's complaining about face pain, if I'm palpating the face and he had herpes zoster on his face, that would be extremely painful for him. And then also I'm going to be palpating his TMJ, this joint right here. If he had any tenderness, I'm going to ask him to open and close his jaw. If he had any tenderness right here, that could be another sign of either temporomandibular joint dysfunction or possible jaw claudication from giant cell arteritis. Okay, so for the eyes, we are inspecting the internal eyelids, and again, with inspecting, you're just looking. You're checking for, again, swelling, redness, any bruising. If an eye is like shut from swelling, you're kind of just like getting a general picture. For the eyelids, you're looking for ptosis or edema. If that's present, that can indicate ocular nerve lesion or a cluster headache. Also, herpes zoster can also infiltrate the eyes. So you're going to look at the eyes and see if there's any evidence of the herpes zoster infiltrating the eye. And then you're also inspecting for optic atrophy. This is common in multiple sclerosis and temporal arteritis. And again, you're just looking for these findings. So now with the mouth, since you're looking inside of the mouth, you're going to want to take your ophthalmoscope. So internally and externally, you're going to be inspecting the mouth, making sure that there's, again, no lesions, possible herpes zoster. But inside the mouth, you're looking for any trauma, any missing teeth, any evidence of dental caries, any general or abnormalities that could be causing his pain. So you just want to make sure that everything in his mouth is looking okay. We're going to be palpating. I don't have any gloves on, but I would palpate his lips and gums and see if that palpation would provoke pain. In this patient, that is a very high possibility. We're thinking he most likely has trigeminal neuralgia, so palpating the lips and the gums could bring back on that pain. So heart and lungs, we're gonna just auscultate for completeness sake, because you do that on every patient just to make sure you're hearing the normal breath sounds throughout all lung fields. You're checking and making sure that there's no crackles, rails. Also for the heart, you're confirming that the S1 and the S2 are heard with no murmurs, rubs, or gallops. So I'm going to do a quick listen to his heart and lungs. Take a few deep breaths for me.